One of the most common instances of nursing home neglect that we see is when nursing home patients fall and suffer fractures or head injuries. And the question a lot of people have is, what were the fall risk precautions that were put in place? Not every single fall at a nursing home is a result of negligence, but a lot of them are. Studies show that there are 1.5 falls in nursing homes per bed. So over the course of a year, one certain room in a nursing home will see a patient fall 1.5 times. And in a lot of those cases, there's an injury. The most common is a fractured hip, although we see other types of broken bones and brain injuries that can result in death. So what are some of the fall risk precautions that nursing homes are supposed to put in place? Well, it depends how much of a fall risk they are. Nursing homes, when they intake a new resident, are supposed to perform what's called a minimum data set, and using that data come up with a plan of care if the patient is at risk for falls. And one of the biggest red flags to see whether they're a high fall risk is a history of falls. And a lot of elderly patients in nursing homes do have that prior history of falls. So what are the precautions they're supposed to put in place if somebody is a serious fall risk? Well, one of the most important things to do is to have a call light within reach, where if a resident needs help with going to the bathroom or whatever they may need, the nursing home nurse or nursing home assistant aide can be on call. We'll see that the patient needs something and it can come to the room. Another important thing is a toileting schedule. We see a lot of falls occur when a resident is trying to get out of their own bed and go to the bathroom. If the nursing home can implement a schedule where they assist the resident get to the toilet in some frequency of manner, then it's less likely that a patient will get out of bed on their own. Another thing nursing homes can do is put serious fall risk patients very close to the nurse's station so that there's a short distance away between a nursing home employee and that patient's room. And there's other things they can do, like fall resistant socks, making sure the lighting is good. And we just see in a lot of instances that not all of the proper fall precautions are being taken by the nursing home. And if we can prove that they failed to do what was medically appropriate, then it can be considered medical negligence. And if so, you can pursue a claim for the injuries or death of your loved one, assuming that those fall risk precautions were medically needed and were not put in place.